Good morning, good afternoon, good evening, good wherever you are. This is again Dr. Mizan from Mizan Coaching, and today we will be going over ways to improve healthcare communication. So what this basically means is how do we prevent things falling through the cracks? So from consultant to primary care or hospitalist, from doctor to nurse, vice versa, from techs to nurses, case managers, etc., etc. So it's a lot, and basically what we found in our hundreds and hundreds of medical legal cases is that the primary cause of medical errors are due to lack of communication, or rather what I like to call lack of proper communication. Because many times, you have for example, a nurse informing a doctor of a patient's status, but the nurse doesn't use appropriate healthcare terminology, or a physician or a consultant simply says something like recommend increasing dose of Lasix, but the nephrologist or whoever doesn't increase the dose him or herself. So, we need to be extremely explicit in our language, in our instructions. And remember that, these are human lives. So it's not just fixing a car and sending it to another provider. Everyone in the hospital, everyone even in an outpatient office, such as the MA, the secretary, even it starts in the lobby, right? So the secretary, the MA, the outpatient general physician or general provider, everyone needs to work in a team setting, and communication needs to be extremely efficient, but also thorough. So basically, if you came here from my short, we'll go over the three tips. So remember that the first tip is to perform thorough chart reviews. The second tip is to perform thorough handoffs, and the third tip is to basically hold frequent, I wouldn't say like frequent, but hold daily IDT meetings regarding your patient. So whether this be just a phone call to a nurse, or it doesn't have to be a formal thing, it would be great if it's formal, but we'll go through that too. And okay, so why are we making this video? The reason why it's important to improve healthcare communication is because improving communication between healthcare professionals is crucial for enhancing patient care, reducing medical errors, and promoting collaboration. So number one, utilizing health information technology. So what I mean by this is just do a thorough chart review, right? So, like I remember back in, many residents or interns, like they just sort of, they see a patient, they check their last admission, and it's like, oh, Mr. D is here for CHF exacerbation. So that's probably why he's here, right? So then you go down to the ED, you do a physical exam, you do a history, and it's like, okay, yeah, sounds like CHF exacerbation, right? But then, little unbeknownst to you, the second previous admission, he came in for what have you, COPD exacerbation or something or other, right? Like, or maybe he has like recurrent UTIs or something, right? So it's like, it's always important to do a more thorough chart review. So what I wrote here is implementing EHRs, electronic health records, and other health information systems can significantly improve communication among healthcare professionals. EHRs or EMRs allow for easier access to patient information, facilitate real-time updates, and enable secure messaging between team members. And again, every EHR is different. I know that Epic is like Epic, like it's pretty much everywhere, and it's great. Like I love Epic, but there's also Cerner, there's other EMRs out there. So make sure that you use it. You send, you write event notes whenever they occur. If you watch my other videos on how to CYA, like cover your behind, make sure you always write event notes with like anything that happens. If there is a miscommunication that's caught, make an event note. So really just performing thorough chart reviews ensures proper communication between providers through time, right? So from like doctor to doctor from a month ago when the patient was admitted previously. Number two, perform thorough handoffs, such as using iPass. So iPass is a standardized method to basically go over the condition of a patient, how severe their situation is. So obviously the more severe patients need to have a higher severity ratings. So those are the ones that you need to devote more time on during your shift. So basically, implement standardized communication protocols. Establishing standardized protocols for communication, such as a structured handoff process during shift changes, can enhance clarity and reduce the risk of errors. These protocols should include essential details about the patient's conditions, treatment plans, and any immediate concerns. And again, all of us who are either in residency or have gone through residency, we know, like, let's just be honest, right? So this is where things fall through the cracks. So I know if you're tired, if you had a 12-hour shift and you just want to go home, these are human lives, right? So that's why my field exists. Like, there's too many errors, and our job here at Mizan Coaching is to try to reduce the number of errors that we see. So, right, like, even if you're tired, make sure that you give each patient the time and effort that they deserve. So be very thorough, explain the status, explain exactly what medications they should be on, explain what, for example, like any labs or imaging that need to be followed up on, and the timeliness of it. So if there's a CT head that, like, the night shift resident needs to check, like, within 10 minutes, say that, right? Okay, and lastly, hold regular interdisciplinary team meetings, also known as like IDT meetings, to know the full condition of a patient. And this is really due to foster a culture of open communication. And, basically the reason why is because a healthcare team is not just doctors, right? Like, that's a very egotistic, arrogant way of looking at medicine. It's, patients are taken care of by an entire team: doctors, nurses, MAs, CRNAs, techs, etc., 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 PAs, NPs, etc. So every single piece of the machine is necessary and valued. And so, everyone needs to come together, provide their input, have an open, safe environment where they can do so. And, what are the benefits of this? Then everyone knows exactly what's going on with the patient, right? So, like, even, for example, like, let's say like the night float nurse or what have you, like, he or she needs to be aware of what occurred during the daytime, right? Like, if we're doing serial troponins or something, why are they doing serial troponins? Is it demand ischemia? Is it, like, risk of, like, a recurrent MI? So, always make sure that you value each other and you fully communicate with each other, regardless of if you're a physician, if you're a nurse, etc., etc. Yeah, so, these are 3 really easy, like, I said easy tips, but in practice are not very easy to implement, right? But like, try your hardest, to improve your hospital, your clinic, your own private practice. So again, the 3 tips are: perform thorough chart reviews, perform thorough handoffs such as IPASS, and number 3, hold regular interdisciplinary team meetings. Check out our other videos on ways to document more efficiently and ways to cover your behind, how to protect your practice. And if you do have any questions or concerns, if you have any video ideas that you'd like our Mizan Coaching to go over, please leave comments or just email us at our email on the profile page. And until next time, thanks. Bye.